The truth of this system is it's such a simple system. Most people say it's so simple that there's no way we can do it because it's just too simple. But I say that this system can be integrated so smoothly into the existing system that exists right now. It would not affect anything. We would go we went from lead to no lead. And it didn't even, we used the same tanks in the ground. All they did was make the hole bigger for the no lead. So if you grabbed the wrong hose by mistake, you couldn't put the no lead in your regular car. This system would so easily be incorporated, it would just phase itself in and the new system would just phase itself out. There would be no interruptions with our healthcare system, no ripping down, no tearing apart the system in any way. People would see its value, start to get on board, start to go with it, and I think 1, 2, 3, it would just fall into place, just like any good system does. You don't have to rip a whole entire system out to start a new system. But if we don't do something, we will be on government-run healthcare within 5 to 10 years, I project. I can't see how we would. We're ready. Everywhere we look, we see companies trying to drop healthcare for their people. And another problem is, suppose you just got laid off. Well, then you just lost your health insurance. Well, guess what? Now when you start your new job, if you got a sickness, you got a pre-existing condition. They might not even cover you. I don't know what they're going to do. That to me is a scary factor with so many people being unemployed at this time. This system would have nothing. They wouldn't even worry whether you had a pre-existing condition because they know in the long run they're going to pay X amount of dollars and the rest they're going to get back from the healthcare lottery. Plus, people are going to $500 million going back into the economy every week. You know how that's going to stimulate this economy? That's a strong statement. We need to stimulate this economy. That's one simple way I could see it stimulating it without a big problem. People will play the lottery in good times and in bad times. Okay, taxes, you don't get taxes in bad times. Look at Germany. Germany's going through they can't pay all their medical because when people aren't working, they can't pay taxes. People aren't buying cars, you're not getting sales tax. You're not getting that tax revenue. In bad times, people play the lottery. In mediocre times, it's okay. In really good times, you're going to do better in really good times and better in bad times. People are hoping to hit that lottery and pay their bills off or win.
And there'll be certainly more competition with more insurance companies.
Absolutely. You'll see commercials all the time. You don't see any commercials about healthcare. What commercials do you see? They're just telling you that they're healthcare. They don't say, we'll give you a better rate. You never hear them talking about rates on a healthcare commercial. You'll hear rates all the time on automobile insurance companies, but you're not going to hear it on that. So that's the important factor. But the lottery is voluntary. You don't have to do it. If you choose to do it, fine. I think they could put a stipulation in because the way I wrote it where you can get a tax write-off, well, if you put the money in, then you get a tax write-off. But another factor is all insurance is a gamble. You're just betting on whether you're going to be healthy or not, and they're taking the bet. So in a roundabout way, all insurance is you're betting. When you look at it, how else could you see it? They're betting on the odds that you're not going to get sick. You're betting on the odds possibly you will, that you'll be covered. So, but again, if it's something that you feel you shouldn't do, then don't do it because this system, nobody's forcing you. Nobody's making you do this. This is totally voluntary. It's a total voluntary system. And like I said before, those numbers are extremely low, extremely conservative. So, and I wanted to go that way. I spent 20 minutes on a calculator double checking those numbers to make sure they were right. It was just mind-boggling, $2 billion a week. I could see it hitting 4 to 6, but I didn't want to put that in there because then you look kind of ridiculous. Even saying $2 billion sounds insane. But the numbers were rock solid, so we'll see.
Now you went to Washington, D.C. in March of 2010 and spoke to a number of senators and some representatives. What was their reaction?
They were very nice to me, but they were in the middle of their own controversy up there, what they're going to vote on, what they weren't going to vote on. So I felt when I went there it was too late. I already knew that the papers were signed, sealed, and delivered. I didn't feel that we were going to get anywhere at that time. It was too far into the signing that they weren't going to look at that book at that time. In fact, they probably looked at the book and said nice, but they already had agendas, not good or bad agendas, but they were such a battle going on at that moment. Looking at my book wasn't their top priority. I think now that the new elections are coming, we're seeing the problems we're going to have with healthcare. I think it's time again. In fact, I actually took the books and just put them in the garage. I was tired. This was all my own money, my own time, going to Washington. I really wasn't trying to make money on this situation. I was trying to help save the health insurance system because I felt that it's very compatible to the automobile insurance business if we look at it. It just needed a little kicker. It needed a little helper. And the helper, I felt, was the lottery system. That is going to take care of the upper end, the critically ill end. So when you take that extra step that we have, like I said earlier, in the 40s you die. We get healed. There's so many, and they're going to come out with more and more ways of healing us, and that's going to cost us money. How else are we going to do it? If we go to government run, you're not going to get that. You know what that system's going to be like. It's going to take you 2 or 3 weeks to get, go get a schedule, or get to see the doctor, get to go see your cancer patient doctor. This system will work where they'll actually even be paying the hospitals faster because they want to get reimbursed quicker. So even then, you'll find less hospitals closing down, shutting down, because they'll be getting their monies. Okay, so we got to get that money stirred back up. We got to get money back into the system. I can't see hiring 18,000 IRS agents is going to police businesses is going to help the health insurance business or the healthcare industry. That $18,000 IRS agents is roughly $450 million a year in salaries. That's not including the buildings. That's not including all the maintenance that's going to be done, the cars, their insurances, and everything else. You're talking close to $2 billion going just to police the small businessman to make sure he's giving his guys. How is that helping health insurance? For the life of me, I can't see how that's going to help it. This system will. This is a strong, rock-solid business plan. This is not some fly-by-night business plan. But I need the insurance companies to look at it, the small automobile insurance companies. I do need the businessmen to take a look at this. They got to get behind me. There's only so much I can do. This is a big, big plan. It needs big people. It needs America looking at this plan, studying it, seeing its value, seeing how they once again can have health care for their children. They can take it wherever they go. They don't have... How many people I talk to, their wives are working just for health care, okay, and they hate the job, but the only reason they're there is because if they don't, they're going to have any coverage for their children?
You had your own personal experience at your own business and having to pull back on the health care.
I had to. It went 4 times the amount it originally was. I had no choice but I couldn't give it to them anymore. And I wasn't alone. Every small businessman I talked to was going through the exact same thing. So that's why I started studying the system. Wasn't trying to hurt or take the blame or anything. I was trying to find a new mathematical way that we could possibly save the health insurance industry. If we don't save it, within 5 to 10 years, we will be on government-run health care because they're going to bail out. They're already accumulating money to get ready to go into other businesses. When the numbers no longer work at all, or only the rich can afford a health care plan, but even they're not going to be able to afford their plans because you keep dropping more and more people out of the percentages. If you keep taking people out, then the numbers have to go up because the odds are against you. So.
How about, just one last question, in terms of a prototype? Could it work maybe in trying this system in 3 states or 5 states? That's
what I was saying too. Really, I felt that instead of doing it, we've done this before. Take 2 or 3 states. Take a southern state, take a northern state. Figure out which states you want to choose, 2 to 3 states, and try it there. We don't have to go through the whole entire system. But I'll guarantee you, once you see how this system starts to go into place, it'll just fall right into place. I really think it's a strong, rock-solid system.